Afternoon, everyone. Hope you are all doing well. Welcome to today's webinar, Quality Assurance Part 2. That is the second part of the two-part series focusing on quality assurance in the context of humanitarian and emergency settings. This webinar continues this important topic of quality assurance that our colleagues Barbara and Greg shared in Part 1, which mostly focused on the products we managed and how to help ensure that they are of good quality. We will give you information on accessing the previous recording at the end of this webinar in case you were not able to attend or if you want to review those contents. We will also be recording this webinar and sharing the link afterwards. As always, we're very happy to have you with us, and a special welcome to anyone who is joining our webinar series for the first time. My name is Anabella Sánchez, and I am joined by my colleague Nora Quesada to present this webinar. Nora, can you please introduce yourself to our audience?
Yes, hi, good morning, good afternoon, and good evening, everyone. My name is Nora Quesada. I've worked in international development for several years now in the fields of reproductive health, system strengthening, and supply chain capacity building in Asia, Africa, and Latin America. And I'm very glad to share this webinar with all of you today. Thank you, Anabella.
Thank you, Nora. And I am Anabella Sánchez. During the last 25 years, I have worked in supply chain management for public health and NGOs, reproductive health, and health advocacy. Our colleague Nadia Olson, who is the JSI program manager for the USAID Humanitarian Aid Capacity Building Program, will be joining us for the question and answer session at the end of the presentation. Welcome, Nadia. Thank you for being with us.
Thank you, Anabella and Nora. It's a pleasure to be here with everybody.
Thank you. And again, we're happy to have all of you with us today. As we get started, we invite everyone to say hello. I'm seeing that you already have. So continue saying hello to others using only the chat function in Zoom, please. You may also send your questions and we should have time to answer them at the end of the presentation. So please use only the Q&A button found at the bottom of your screen at any time during the presentation. Please do not use the chat button for this so that we may keep track of all of your questions. As we move along through each of the slides, please write your questions so that we can address them in a timely manner. So now let's start with a quick introduction and overview. First, I would like to remind you of the USAID Bureau for Humanitarian Assistance Capacity Building Program, through which this webinar is made possible. The program is being implemented by JSI Research and Training Institute to build capacity to improve commodity management in humanitarian and disaster settings. The objectives of the program, as you see on the screen, are first to develop training curriculum, country case studies, and other learning tools. Also to conduct pharmaceutical and medical commodities supply chain capacity building activities. Very important, share learning with regional and global communities, and to support partners to institutionalize better supply chain practices into your policies and procedures. And Nora will share with you the objective of this webinar.
Thank you, Anabella. Okay, now let's go over the objectives of this webinar. During these sessions, we will briefly review the contents of the Part 1 webinar on quality assurance. We will also identify actions that supply chain managers can take at various stages of the logistics cycle for product quality assurance in humanitarian settings. We will also identify additional resources on quality assurance that you can read at your leisure, provide instruction of post-webinar game so that you can continue reviewing and learning the content of this session. And of course, we will have the Q&A section where you will have the opportunity to ask questions.
Thank you, Nora. When we look at the humanitarian response framework that you see on the screen, we can say that Product quality assurance intrinsically happens when there is a system and a culture with clear roles and priorities to monitor the quality of products, both pharmaceutical and non-pharmaceutical products. This is true for supply chain management in stable or humanitarian and emergency response settings. But emphasis on quality assurance needs to be made during the preparedness phase in the form of your organizational policies, standard operating procedures, indicators and benchmarks, also roles and responsibilities to carry out product quality assurance actions throughout the logistics cycle and during the humanitarian response phases.
So in the next slides, we will summarize the first part of the quality assurance webinar series, as we mentioned before, including the products used during the humanitarian crisis, as well as some of the key themes that we shared in previous webinars.
I think this will be very helpful for those of you that did not participate in the webinar part 1. So in an emergency situation or humanitarian context, we're managing a lot of a variety of products, not only to respond to the humanitarian situation or to the emergency, but also to maintain some level of daily life. Here on the left, you see examples of products needed during outbreaks and pandemics. And on the right, examples of products needed during natural or man-made disasters. In both instances, while some products will depend on the specific type of emergency, the type of response needed, the geographical areas and populations that are affected, or other specific considerations, this could equally be any and all products that we all need to live, such as housing, tents, other temporary shelter, food and water, equipment, healthcare products, including medicines, medical equipment, reproductive health products, and personal protective equipment, and the list goes on and on. So,
And as I mentioned before, some of the key themes we reviewed in part 1 of this webinar series are, for example, the quality assurance. And this is defined as the maintenance of a desired level of quality in a service or product, especially by means of attention to every stage of the process for production, warehousing, and delivery. Also, the product quality assurance, here the main message is that we need to ensure that we do product quality assurance either by doing it ourselves when possible, for example, by conducting our own laboratory testing or by doing visual inspections. We may also rely on others to do so, for example, relying on processes established by donors, manufacturers, stringent regulatory authorities, and WHO. In regards to product specifications, generally our expectations are expressed in the specifications of the products, what we really want and need. Sometimes the organization defines them, but some other times the organizations choose products with already defined specifications. These specifications can be defined for all kinds of products, including pharmaceutical, non-pharmaceutical, and non-medical products. The visual inspection is really important because this is a routine practice to implement every time products are received from manufacturer, a donor, or a supplier. It is always a good opportunity to do visual inspection when a warehouse or clinic or a population receives products, when conducting physical inventory, when investigating complaints from clients, when products are about to expire, when products show signs of damage, and when dispensing products to clients.
thank you, Nora. In part 1 of this webinar series, we also talked about product specifications. Whether we are talking about pharmaceuticals or not, product quality assurance will be based on these specifications, as we need to have some minimal acceptable standards for the products we procure and use. Sometimes we define all of these specifications for the products we're buying, distributing, and using, but sometimes we have to rely on others to do this. Regardless of who defines the specifications, in the end, we judge the quality of the products against these specifications. On the other hand, for pharmaceutical products, we can think of pharmacopoeial specifications, which simply means the collection of specs of chemical substances for pharmaceutical use. In other words, the standards for these products. Some of those are listed here. We can also think of general specifications that are applicable to pharmaceutical as well as to other products, and some of those are also listed here on the right. For shelf life and required storage conditions, for example, you're probably familiar with. Others, such as product stability, we're not only less familiar, but we also are likely able to do this testing for. However, as general information, stability refers to how well a pharmaceutical can remain on the same specification state as it was developed and approved. For example, keeping physical, chemical, microbiological, toxicological, protective, and informational stability.
And we all know that product quality assurance is especially important in that it can be one of the most effective practices to detect counterfeit or substandard products or even deter them from getting into our system. For the elements related to the pharmacopoeial specifications, probably the only recourse is likely to quarantine the products while they are sent to a lab for analysis. But even if in the absence of that measure, we can always rely on visual inspection of some elements, such as the packaging, including the marking and labeling, or to see if it shows signs that the product is not genuine. Checking if a required seal is missing or of the wrong quality. Observing if the package colors are wrong or the logos are misrepresented. Checking if the font is the wrong size or style. And sometimes looking for words on the package that are misspelled. Doing a visual inspection correctly also requires providing training to the staff who handle the products. And this should be an important part of the process to ensure the quality throughout the logistics system. Also, in addition to visual inspection, we can do other things. For example, for those who watched the previous webinar, you probably remember that we shared the experience of the Nigeria's National Agency for Food and Drug Administration and Control, and how 3 technology companies are using mobile phone apps to authenticate drugs which are at risk or counterfeiting. In that case, we talked about antibiotics, antimalarial drugs, and others. Fortunately, nowadays, technology is another great tool organizations can rely on to implement quality assurance measures, and we encourage you all to do so if at all possible.
Thank you, Nora. Now that we have summarized part 1 of this webinar series, let's move on to talk about the actions you all can take to protect product quality at each stage of the logistics cycle that you already know.
Yes, and first of all, here's a reminder of the importance of the supply chain in ensuring commodity security. And this would be for any situation, including an emergency or a stable context. In the quote on the left, you can see that we highlighted the phrase focusing on the importance of providing quality health supplies. We also see on the right a reminder of the 6 rights of logistics, and we are not surprised to see that the right condition, meaning products of good quality, is among the 6 rights.
Before going through each function of the logistics cycle, we would like to invite you to answer a couple of questions in the form of a poll. Let's see if it can pop up on the screen. And we will give you some time to respond. The 2 questions. And as you answered the 2 questions, we will give you a few more seconds. Since these are two questions in one poll, we will give you a few more seconds. While we give you a few more time, I was remembering the questions that you shared with us in previous webinar, and all of the themes that were brought up were very important, and that's why we are emphasizing some of those questions that you shared with us previously. So let's see if we can look at the results, or do we keep more time? Here we come. Okay, so it's interesting. 71% of you consider that all of the above in both questions is the correct answer. And the answer for question 2, can we show it? This is the result for question 1. And for the second question, Nora, do you think?
Yeah, Daniel is handling the poll, Anabella.
Mm-hmm. I could not see the responses on the second question, but it is interesting.
Just need to scroll down.
Can you put it back up, Daniel? Because I don't see the poll anymore. Apologies. If not, we can we could see that 71% of you consider that all of the above was needed for quality assurance. And while this is true, you will agree that this can be difficult in the middle of emergency situations, unless your organization prepares a plan on how to face an emergency during the preparedness phase. Now let's look at our representation of the logistics cycle. Here you see the product quality assurance is not shown explicitly because it occurs as a cross-cutting element throughout all the logistics cycle. And we will now review some actions to ensure that quality of health products at every step of the cycle is secured. All of these actions would probably apply equally to products that are routinely procured, as well as those procured in very special circumstances, such as during an emergency or a humanitarian crisis, like, for example, all of us are following the Haiti news, for example. So in very acute situations, we also need to strive for protecting quality of health products.
So as Anabella pointed out in the previous slide, if we start with product selection, this refers to the process by which health programs and organizations select, evaluate, and ultimately procure the products that will be used. Humanitarian partners have a responsibility to select the appropriate supplies and suppliers to deliver quality health products to their beneficiaries. On the other hand, end users deserve quality products. Even after products have been distributed to the population, organizations should strive to continue to monitor quality. It is essential to know how end users feel about the quality of the products and whether or not they are satisfied with the product and service they receive. Especially in a crisis, receiving an antibiotic or another life-saving product of substandard quality can be a matter of life or death. We will now see some of the actions that we can take during the product selection process in order to protect the quality of the product.
Thank you, Nora. As we mentioned earlier, it is important that during the preparedness phase and when we select health products, the first action is to review all the existing guidelines available. For example, an essential medicines list describes the products that satisfy the priority healthcare needs of a population and are approved for use throughout a country. Often, a product should be relevant to the local disease patterns, proven to be of good quality, effective and safe, and cost-effective when considering total treatment cost. These lists can be a national list, a WHO list, or your organization's medicines list. Health workers in your organization also need to adhere to standard treatment guidelines, which outline the quality of treatment to be given. For example, the full course of an antibiotic. To help ensure the quality of health products procured by organizations, it is important to examine guidelines, prescribing practices, and registration status during product selection to avoid delays and procurement of inappropriate products. Specific product characteristics, as we have mentioned before, such as formulations, dosages, shelf life, temperature requirements, number of units per packs, unit cost, and others are analyzed and determined during this important phase. This is why one action you can take for a collaborative approach is forming an interdisciplinary committee to produce the essential medicine list. Furthermore, you should compare prices of substitutable products, ensuring that they are equally medically appropriate and in line with your organization's specific needs. And finally, it is very important to listen to the customers, to the patients, to hear what they say about the product they receive.
We have been saying that organizations and programs should plan some actions to ensure the quality of any product way before a crisis emerges. Usually, organizations should consider including these actions in the preparedness phase of humanitarian assistance. So, during the selection process, we can include some indicators that could help us ensure the quality of the products we select when a crisis emerges. Here we have 3 examples of indicators to verify that activities to secure the quality of health products are carried out successfully during the product selection process. For example, you may want to include in your quality assurance manual the percentage of products procured that are registered in country, the percentage of products that undergo quality testing, that of course should be done before the crisis emerges, and those that meet stringent regulatory authority or WHO standards.
We now move to the quantification phase. Quantifying and procuring the right products at the right price based on appropriate product selection and use play an important role in product quality monitoring. Quantification is a continuous process that includes regular monitoring and updating. Not only it is important to assess the quality of the data and the assumptions that you use to calculate the initial forecast, but to assess the accuracy of the forecast. The actual quantities consumed should be compared with the forecasted quantities. Let's see what actions and considerations are important for you to take during the different steps of the quantification process in order to protect product quality.
Yes, Anabella. During the quantification process, several actions can protect the quality of the health products. For example, every product should be on the National Essential Medicines list, as you mentioned before, be approved and registered for use in the country, and be included in appropriate standard treatment guidelines. Also, service providers must be trained to correctly manipulate and dispense the products before they are received, distributed, and dispensed to clients and users. This is very important, especially when countries or organizations receive donated products that probably the service providers are not familiar with. When doing the forecasting, we need to ask ourselves this question: do the data available accurately represent what future demand might be? The completeness, accuracy, and availability of the data really determines the accuracy of the forecast. In this step, it is recommendable to continually monitor and review changes in demand due to changes in demographic and population trends, disease burden, and migrant and displaced population. So it is advisable to use different data sources to validate forecast accuracy, to avoid overstocking products that could deteriorate in warehouses or in the field. During the supply planning, be sure to verify patents, registration, and pre-qualification status. Check the supplier's performance and lead times, shipping and handling cost, funding sources and cycles, procurement mechanisms if using local or international procurement, and their lead times. And also consider customs clearance requirements, fees, and lead times, as well as in-country storage and transport capacity. Not knowing all these aspects before a crisis emerges can represent keeping the products under undesirable conditions at ports, warehouses, and other sites that could eventually deteriorate the quality of the products.
Thank you, Nora. What you just said really made me think about how important quantification it is to protect product quality. So during this quantification process, we're going to share just one important indicator in this process, which is the forecast accuracy, the percent of variation between forecast and actual demand. Over time and with regular monitoring, the forecast accuracy and the overall quality of your quantifications can improve in order to protect product quality. Why? Because it helps avoid excess products that will later become expired products or stored in inadequate facilities. It also will avoid stockpiling of excess products, as Nora mentioned. And before we continue, just a parenthesis, we remind you to write your questions and comments in the Q&A section as we advance the slides. We will also share the recording of this webinar after the presentation, along with the presentation slides and other resources for you.
So now let's move in the cycle and talk about procurement. Only effective and rigorous procurement policies, processes, and procedures can ensure a reliable flow of commodities in the supply chain and can effectively respond to any contextual or operational changes in the supply chain, especially in humanitarian contexts. Procurement process can help ensure product quality. As you all would imagine, the procurement process is affected by preceding elements of the logistics cycle, and of course the regulatory context as well. For example, previous considerations in product selection and quantification need to be reflected in the tendering documents when we procure supplies.
In terms of the actions that a supply manager can take during the procurement process, let's look at some of those here. Here we emphasize again the technical specifications included in the tender document, which identify key product quality requirements such as product certification, pharmacopoeia standards when applicable, labeling and packaging requirements, shelf life requirements, etc. All of these are essential and protect from counterfeit products entering the supply chain system of your organizations, which we all know it is one of the concerns amongst your organizations. The next action relates to market analysis, which involves analyzing the competition criteria in terms of price, quality, service, and other aspects. Are there any alternatives or substitute products or suppliers? Are there branded, patented products or generic products? The next action involves checking the products approved by the stringent regulatory authority. This approval will help verify the sameness of the product to ensure that the medical products is the same as the one that has been assessed or approved by the reference authority. We all know that following the National Drug Regulatory Agency can be challenging during an acute phase. This is why looking at these documents during the preparedness phase is very important. The pre-qualification of medical supplies and the certification of a supplier are key concepts to ensure quality. However, because of limited technical capacity and resources, the majority of humanitarian partners may delegate this function to their suppliers. Also, the funding donor or the procuring organization may pre-qualify sources for its procurement activities. A few examples, suppliers used by USAID, UNICEF, UNFPA, the Global Fund are options. WHO pre-qualified products, including products reviewed by the WHO Expert Review Panel with a category 1 or 2. For more information on ERP, you will find a WHO document in the resources section of this presentation. Suppliers with certification of good manufacturing practices is also an option. And of course, ISO certifications. And last but not least, you definitely might know the statistics about the percentage of global pharmaceutical commerce related to counterfeit drugs, which some estimate that can even reach $21 billion. So avoiding their entry in the supply chain system should be an ongoing task. In part 1 webinar, we mentioned the Nigeria experience, like Nora said. We also found a TED Talk conference, and we learned about a scanner device called RxAll, just in case you haven't heard of it, that has a proprietary molecular sensor that can identify the quality of the prescription drugs in a matter of seconds. We will include this information and the link in the additional resources for you to check it out.
And for this logistics function, we have selected 3 indicators. Of course, there are many more you can look at and choose from based on your needs and your organizational context. In this case, the first indicator will help you monitor the level of compliance of procurement agents and distributors based on the Model Quality Assurance System for Procurement Agents by WHO. On-time delivery is another measure that will help you evaluate the supplier's performance to deliver products on time. And the third indicator is also helpful, similar to the on-time delivery, but this one will provide feedback to the supplier's overall performance. You may be wondering why these indicators relate to protecting product quality. Well, because quality also involves the services and the supplier's capacity to offer high quality pre-qualified products. Ensuring the 6 rights we saw earlier will also help provide product quality and service, especially when analyzing potential suppliers. And let's keep in mind that all these processes of setting up indicators and qualifying suppliers should be done in the preparedness phase, because during a crisis, it's very challenging to do so.
Thank you, Nora, for these ideas. As we continue to move in the logistics cycle, now let's talk about inventory strategy, which plays a key role in every supply chain. Its basic definition refers to a stock of goods kept in a facility ready for sale or use in the future. Inventory management is an essential part of the logistics and supply chain management and should address both existing inventory within your organizations and from others in-country sources of supplies that can be accessed in a timely manner. In humanitarian logistics as compared to commercial logistics, which considers lead time as an important factor of service level, lead time does not have such an attention. In the commercial sector, inventory management is a core logistics function dominated by pull systems. In contrast, in a humanitarian setting, disaster relief follows usually a push strategy in initial crisis situations and turns into pull systems over time when the disaster situations are diminishing.
Also, in an inventory strategy, especially under humanitarian settings, prepositioning supplies is one of the effective strategies to place supplies closer to the population, especially in areas where floods, civil unrest, etc., could block the regular flow of supplies. If your organization opts for this practice, make sure you periodically check how often the inventory rotates, especially if the preposition supplies are used just for emergency purposes. For example, in the case of the health kits. If the crisis is over and you still have an inventory of preposition supplies somewhere, check the expiry dates, use use the products for regular health services, and make sure you replace them with newer extended expiry date products. The idea is to have these supplies available at all times in preparation for the next emergency or crisis. It is important also to keep an adequate inventory tracking system to avoid damage, expiration, and wastage of products. For example, implement a traceability system at all levels. This requires developing documentation that will track and trace the products and supplies throughout the different storage facilities, with records on temperature, environmental conditions, etc. Traceability helps determine if the goods, especially the pharmaceuticals, have been stored properly throughout the supply chain. It is also important to routinely check products for changes in color, texture, and other signs of deterioration, especially when the supplies have not rotated regularly. The inventory, as you all know, should rotate at least every 3 to 6 months, especially in areas where the storage conditions and the climate are not appropriate for storing products for long periods. In this case, it is advisable to check the inventory regularly, and if the products have not rotated for the past 6 months, you should either use them or redistribute them to other facilities. Also, encourage the end users or the clients to report any problem with the quality of the products they receive, especially pharmaceuticals. Substandard medicines could put the population's health at risk, and it's crucial to develop a system where clients can file complaint reports. And lastly, an inventory strategy should implement recall procedures if there's a need to withdraw supplies from circulation.
Thank you, Nora, for all these interesting and very important actions. And now we also, for every logistics function, we provide you with a few ideas on indicators on how to monitor quality. Here we have some suggestions on how to measure how effective your inventory strategy is. The first one is the product fill rate that can be used to measure the order fulfillment performance of a single delivery or for all deliverables, deliveries during a time period. You can also use inventory accuracy. This refers to how closely your inventory records match your physical inventory. As you know, you can't imagine inventory if you cannot manage inventory if you don't know what you have in stock. Good inventory management requires at least 95% accuracy. This means you should have regular inventory counts. You can do it by taking a random sampling of stock and check if anything is missing. Ideally, you should count the items that generate most of your distribution several times a year. Slow-moving products need only an annual count. While you do your inventory counts, it is a perfect opportunity to check visually the quality of the products and verify current physical conditions, expiry dates, and other physical characteristics.
As we continue to move along the logistics cycle, probably warehousing and distribution are the two supply chain activities that often require the most significant proportion of a supply chain operations budget. When a supply chain manager has well-functioning warehousing and distribution management systems, He or she can extend the working life of public health infrastructure, reduce the overall cost of transport, and improve the provision of public health services. In addition, two of the primary purposes of warehousing are to protect the integrity and quality of the products and to ensure the shelf life of pharmaceuticals and other sensitive products throughout the supply chain to guarantee they reach the clients in the best possible conditions. When you have the time, we invite you to take a look at the JSI Supply Chain Manager's Handbook, where you will find more information about these two important processes of the logistics cycle.
Thank you, Nora. And two basic types of damage may occur during shipping and storage that affect product quality: mechanical and chemical. Mechanical damage is caused by physical stresses such as crushing or tearing when the products are loaded, offloaded, or when cartons or inner boxes are stacked. This kind of damage is usually limited to crushed or torn parts. On the other hand, chemical damage is more difficult to detect and confirm during a visual inspection. Laboratory testing is usually required. Some indications of chemical damage may include changes in the color, the odor, or consistency of the product. A good warehousing and distribution strategy should consider the following measures. Share pictures of original product in good condition and quality. Distribute traceability reports to show where and under what conditions the product has been stored in previous storage facilities. If local conditions could adversely affect the products, rotate them faster than previously planned. Do visual inspection before and during distribution and record the condition of the products before they leave the facility. This can easily be done now that everybody has a phone. Reinforce the storage and distribution requirements for the products managed at the different locations.
And here we have some suggestions on how to measure the effectiveness of your warehousing and distribution activities, which in turn will help you protect the quality of the products you manage. For example, the on-time delivery measures the percentage of quantities distributed on time or within an agreed time window during a defined period. This measure is particularly critical when a product has a short shelf life. Also, the products arriving in good condition. This indicator measures the percentage of products arriving without any damage during a defined period, especially when products are delivered to the population who probably need them in a life-saving situation. The number of security measures to protect products from theft and mishandling. For example, how many staff have keys to the warehouse and how many people are trained to handle the supplies. And of course, having thermometers located in different in key spots of the warehouse will help monitor the temperature. Keeping a record of temperatures for heat or cold sensitive products contributes to the traceability of products throughout the logistics system and provides vital information about potential quality issues.
Okay, so we move on to the next logistics function management support. The heart of the supply chain cycle is here in the center, where the different management components are, for example, performance management, human resources, system design, and the logistics management information systems, among others. All of these components make the logistics process work in a synchronized manner. And the information system plays an essential role in providing the data needed for your decisions at all levels of the supply chain. Management support can extend quality management practices into the supply chain by first promoting visibility, identify issues early on before they become costly quality incidents or even health concerns. The second, traceability, understand the root cause and source of product quality issues in your supply chain. And the third is accountability, ensure supply chain partners understand product quality issues and resolution requirements in a timely manner. And fourth, profitability, how to mitigate quality related to financial risk, and to improve supply chain efficiency.
Probably implementing partners and organizations must track inventory and transactions to establish demand better, determine requirements, fill orders faster, and discourage pilferage. However, it may be difficult for partners to develop a comprehensive and collaborative means of visibility across different partners at the acute phase, even if individual partners can quickly set up information systems that track inventory under their own control. However, as we have been saying, during the preparedness phase, organizations and partners should plan how to share information during a crisis and consider developing a standardized form or system for data collection and information sharing that would help decide what products are needed, when and where they are required, and how much is needed. In the early stages of a response effort, organizations should encourage the government or central and regional warehouses in the country to track stock levels and quantities issued to other partners, especially when supplies come through a designated channel. In this case, a local logistic management information system could provide data to quantify needs and also track data on wastage, losses, and stock imbalances to allow the organizations to redistribute supplies across geographical areas that need the products. Also, organizations supporting the service delivery level may already capture much of this data and may need to complete just a standardized form to upstream partners to consolidate regularly. Mobile applications and technologies offer a relatively rapid means to establishing basic visibility of inventories and transactions. However, organizations should plan ahead of time and have these resources available before a crisis emerges.
Thank you, Nora.
In addition, when talking about risk management and to avoid putting at risk the health of the population and the credibility of the institution that procures and distributes the products, it is important to monitor the customer's complaints and remedial follow-up, including recall procedures. Provide or look at any other certification that ensures compliance with at least some of the quality systems regulations, such as the United States QS, the ISO 9001, and so on. Also, supply chain management, does help to ensure quality, as correctly managing your supply chain helps quality be maintained from start to finish of the logistics cycle. Some of the typical solutions in risk management include developing contingency plans to potential events and making investments in receiving, storage, and distribution capacity to better handle relief operations if they are considered to be a potential bottleneck risk. And remember that complaint reports, written or verbal, on product quality are very important for monitoring the condition of the products once they reach the end user, as the ultimate goal is to deliver the products in the right condition to the people who need them. The risk management process is described in detail in the risk management chapter of the JSI Supply Chain Manager's Handbook.
Okay, so here we have some suggestions on how to measure how effective your management support activities are. For example, LMIS reporting rate on losses and expiry products is very helpful. This will demonstrate if quality assurance measures are being followed routinely. Then we have standard quality assurance operating procedures in place. Establishing standard operating procedures to guide the actions to monitor product quality are essential, are very important, especially during the preparedness phase. And third, the staff trained in quality assurance procedures. It is important to measure the percentage of staff that are trained in product quality assurance procedures. This will tell the extent to which a quality assurance mindset is nurtured throughout the supply chain system of your organization.
And we do all of these processes in the logistics cycle to serve customers, which is the ultimate goal of any supply chain. It is at the top of the logistics cycle and entails getting the right goods in the right condition to everyone, everywhere, in the right place at the right time. Quality monitoring of both the product and the service is critical to the success of efforts to promote the appropriate use of products. End users should be counseled to correctly use the products they receive. The results of monitoring client and user satisfaction can be used to inform and guide decision makers on users' preferences and about changes in product selection and use for the next procurement cycle. Remember, serving clients is at the top of the logistics cycle and entails getting the right goods in the right condition to those clients. The selection and quality assurance of the medicines to be provided in a country affected by an emergency is of key importance because if the medicine is not well known by the health professionals who prescribe it, it will not achieve its intended use. In addition, clients should also get familiar with the products once they receive them. Oftentimes, products are wasted because clients don't know how to use them or how to take them.
As Nora pointed out, the logistics cycle begins and ends with the customer in mind. This is why we left this part of the cycle till the end. And this is why the indicators we share with you here are as important as those in previous phases of the logistics cycle. The first one is the customer satisfaction rates on product quality. The products need to respond to the needs of the population, for sure. For example, taking into account age, gender, disease burden, etc. Therefore, it is important to measure customer satisfaction in regards to the quality of the product they receive. And the second indicator is the percentage of defective products due to the misuse by clients relating to measuring the quality, efficacy, and safety attributes of products that are distributed during emergencies and humanitarian aid. In the end, all of these indicators will help you to monitor that the health of the population you serve is not compromised. And that is, at the end, the final goal.
In previous webinars, we mentioned the organization sites that are listed here, and these sites have the main pages where you can search for any topic related to the quality assurance issues. And I'm sure there are thousands others that you can find by doing a search for quality assurance on the internet. In this case, for number 5, sorry, it's misnumbered there, but it's the last bullet on the screen. Information on the WHO pre-qualification. The information is divided by subtopic, and these include areas such as immunization devices and medicine, among others. So it's a very useful source of information. We also added more resources, and here we list some direct links to specific articles related to the logistics functions we covered in today's webinar. Some of these are on the WHO portal, and some are found through other resources.
Thank you, Nora. That brings us to the end of the technical content of this webinar. So let's provide information and instructions about the gaming. As you remember, we have been sharing a game application, and we're gonna go quickly through these instructions so that we hopefully have time for to answer some of your questions. Can we move along to the slides on the instructions to log in? Nora, please. Yes. The registration code for those that already have been playing in the app, it's a different one from previous webinars. It's 3661. And the name of the game is Ensuring Quality Products During Emergencies Part 2. A screenshot is shown in the next slide. so that you can imagine what you're going to find when you enter the app game. And in the next slide, you will see the details of the instructions in case you haven't played yet, and what are the rules of the games. It is very fun. We really invite you to try it if you haven't played it. And it's a lot of fun when you compete with your colleagues. So next slide. So happy gaming. We really hope you use it, and we're reaching almost the end of our presentation. Thank you, Nora.
Yeah, thank you, Anabella. Okay, so we have come to the end of this webinar, and remember that today we reviewed the contents of part 1 webinar on quality assurance, identified actions that supply chain managers can take at various stages of the logistics cycle to ensure product quality. We also identified additional resources on quality assurance and provided instructions for a post-webinar gain so that you can continue reviewing the different topics we discussed today. We do have time for some questions, and I'm sure you have been writing some of those in the Q&A section. So I invite my colleague Nadia to look at the questions and respond some of them if they have not been resolved during the Q&A section.
Thank you, Nora. We've been going through many of the questions and answering them in writing, so the participants can have a look there. And of course, we'll follow up with more detailed answers on all of these for everyone. I'll do what I can in the next 3 minutes to address a few. Several have asked if we are going to share the presentation. Yes, we are. And there are previous presentations as well of historic webinars that we will also share. There's also a YouTube channel with several historic recordings. We'll share all of that so that you can watch all of the historic webinars. This top one here, there's a question about what is the relationship between the quality of products in emergency situations and preparedness and contingency planning. What are the guarantees provided to ensure the quality of the products? Well, in humanitarian settings, of course, there are no guarantees. It is a very fast-paced, difficult environment, often under very extreme conditions, in all sorts of extreme conditions that can have an impact on quality of a product, including weather, conflict, all kind of things, security, counterfeit. But certainly in the emergency preparedness stage, we could do a lot more than we do now to ensure the quality of the product during an emergency. We could have, like we've said, an idea of the key products that could be provided in those settings, and there's a lot of global efforts to do that. But you can also do that nationally or subnationally. You could have already agreements set up with manufacturers so that when or procurement agents, so that when the emergency happens, those contracts are already in place, so you don't have to rush, and you can ensure that those are good quality agents or manufacturers. You could have already gone to or worked with others who have already gone to inspect those manufacturers to make sure that the quality of their products are high. You could have all sorts of things set up before the emergency so that when the emergency happens, you simply activate your response. We often don't do this, and then we're stuck with low quality product or scrambling at the end. You could also have your staff trained, even if someone had also a separate question here, what do you do when there are not trained staff in ensuring quality? And so I think you would have to train all your staff in some very basic concepts of principles to look at and visually inspect product, make sure, just some easy things that they can do just with their line of sight to look at the quality, look at the condition of the product, understand things like the temperature, discoloration, cloudiness. These are things that you wouldn't necessarily have to be an expert to have the ability to do that. And you could train all your staff on that, not just the staff that handle the product. Make it a responsibility of whomever is there. and also work with other partners in a humanitarian setting, because we know there are multiple partners responding in a humanitarian setting, so they may know of something that you don't know, or you may know of something that they don't know. Okay, and I think that's all I can answer for now, because we're at the end of the hour, but we will follow up, and we have follow up already in writing to many, many of the questions, and we will continue to follow up on the other ones in the coming days, and you'll receive those answers.
Great. Thank you, Nadia, and thank you, Anabella. And I just would like to remind everyone that you will be receiving the follow-up email with the additional information, with the questions that we were not able to answer in this time frame, and also all the resources that we discuss. We will also provide the links to the part 1 and part 2 recordings of this webinar and the previous one. And we want to thank you for making time for this webinar in your busy schedules. And finally, we want to be sure to thank you for the very important work that you do in helping to respond to humanitarian crises around the world. Thanks again for everyone, and take care, stay safe and healthy, and see you next time.